Erectile dysfunction is an exceedingly common problem worldwide. Current estimates are that in the US there are some 30 million men experiencing erectile dysfunction. That figure in Australia is around 1 in 5 men experience the similar condition. The prevalence is influenced by age and the incidence increases as we progress through life. Approximately 40% of men at the age of 40 and 70% of men at the age of 70 can experience erectile dysfunction. In terms of definition, erectile dysfunction is really characterized by an inability to have or to maintain an erection that is sufficient enough for penetrative intercourse. Hi, my name is Dr. Charles Chabert. I'm a urologist and director of the Prostate Clinic here in Australia. In the following video, I wanted to highlight for you a world first in terms of managing erectile dysfunction. Please, if you get benefit from this video, consider subscribing, give the video a thumbs up, and please, as always, leave comments, questions, or if you're prepared to, share your story in the comment section down below. Now let's get into it. If we understand the mechanism of an erection, we can begin to understand why men can have troubles achieving an erection and how some of the medications that we use to treat erectile dysfunction actually work. So if we take a deep dive into the microscopic aspects of an erection, following arousal, there is usually dilatation of blood vessels. Those blood vessels allow more blood flow to enter into the penis. As the penis engorges and becomes filled with blood, the veins that allow blood to exit the penis are compressed. So more blood flow gets into the penis than blood leaves, and we end up with an increasing amount of blood within the penis that gives rigidity, increased girth, increased length, and everything that is associated with an erection. So why is erectile dysfunction so common? Well, if we take a step back and look at some of the causes that result in this condition, it may explain why. Crudely speaking, we divide erectile dysfunction into two main causes. One is organic and the other is psychogenic. In essence, the organic causes are related to anything that can result in what is commonly referred to as metabolic syndrome. Blood pressure, cholesterol, impaired sugar control, carrying too much weight, if people have been smokers in the past, or potentially if people have had prostate cancer treatments at some stage. All of these things play a role in reducing blood flow to the penis. Ultimately, the quality of erection is dependent upon how much blood flow gets to the penis. If we look at psychogenic causes of erectile dysfunction, clearly the management of these issues will be different from those individuals who have organic erectile dysfunction. Sometimes people, if they are depressed or if they're anxious, that can lead to issues with confidence and performance anxiety. The way that we manage this really is by couples potentially going to discuss their issues with a counselor, and for some men, cognitive behavioral therapy can be of benefit to try and reduce the anxiety burden that some men feel during the process of sexual activity. When we have issues that promote metabolic dysfunction, high blood pressure, cholesterol, diabetes, and so on, in essence, there is less blood flow that gets to the penis, and so the quality of the erection, the durability of an erection, is reduced. Let's take a look now at some of the medications that are used to try and treat erectile dysfunction. The cornerstone of how we manage this is with a group of tablets that are called phosphodiesterase type 5 inhibitors. In essence, what these drugs do is to inhibit a particular enzyme, phosphodiesterase, and what this does is results in a chemical cascade that allows progressive dilatation of the blood vessels. In essence, this facilitates increased blood flow into the penis, progression in terms of engorgement, and a better quality of erection. Now, many men, when they take PDE5 inhibitors, are worried that when they take a tablet, they're going to have an erection all day. That doesn't happen. What these drugs do is potentiate or boost a body's natural response to sexual stimulus. No stimulus, then there's no erection. There are 3 common drugs that are in use. One is Viagra or sildenafil. The other is tadalafil or Cialis. And the last one is Levitra or Vardenafil. Beyond tablets, beyond PDE5 inhibitors, there are injections. Now, when I have this conversation with many of my patients, they look at me with some surprise and think that I'm not entirely being serious. But yes, there are injections that allow the delivery of a stronger medicine into the base of the penis. So the technical term is that they are intracavernosal injections. Provide a stronger erection. They can give a more durable response, but it does come at a cost. As I said, there is the psychological aspect that comes from injecting the base of your penis. Many men can experience a slight achiness to their erection, and on occasions men can either develop some scar tissue in the penis, or they can have an erection for longer than they would actually like to. Might sound strange if you're staring at this problem from a different angle. Beyond injections, there is also the possibility of vacuum pumps. And vacuum pumps can be a simpler way, a less invasive way of encouraging blood flow into the penis, and used in combination with a penile ring can maintain blood within the penis to facilitate penetrative intercourse. At the end of the line, if men have exhausted those other options, PDE5 inhibitors, vacuum pumps, or injections, the other possibility is surgery, and that's to insert a penile implant. As I say, the simpler methods need to be explored and determined if they are successful or not before we get to a surgical solution. Now, these are specific targeted approaches for men who have organic erectile dysfunction. It should be mentioned that generalized lifestyle modification to try and improve aspects that have led to metabolic dysfunction should be undertaken at the same time. In essence, have a look at your lifestyle. How much exercise are men doing? Are you doing resistive weight training? Have a look at your diet. Are you eating more processed food? Are you eating whole foods? Have a look at these aspects to see where you can make improvements in yourself in conjunction with using adjuncts such as either tablets or injections. Okay, now let's turn our attention to Spontan. Spontan is a world first in terms of how we manage erectile dysfunction. It is, in essence, a nasal spray of vardenafil. That is to say, it is the same intrinsic chemical that we see in Levitra. Levitra was the tablet form of vardenafil, and it could be used in the same way that Viagra or tadalafil, Cialis, could be used to try and promote improvements in erectile function. Now, some of the side effects that we see with PDE5 inhibitors can be flushing or a headache. Sometimes men can experience a little bit of heartburn or a bit of indigestion, and for many men that can limit its use. Now, one of the potential advantages to a nasal delivery is that, number one, from a scientific point of view, it bypasses metabolism in the liver, and as a result of that, the mechanism of action is that it can be active far quicker than if you take a tablet and have to wait for your body to digest it. Crudely speaking, if people take tablets such as Viagra, Cialis, or Levitra, it can be up to around an hour for that tablet to be effective. With a nasal spray, we have the ability to deliver that medication straight into the system. The surface area within the nasal cavity is pretty high, so a single pump in each nostril can deliver a dose of 5 milligrams, which can be more rapidly absorbed and has the potential to give men a more rapid onset of action of around 10 to 15 minutes. In addition, with the nasal delivery, the potential is that men can use, therefore, a lower dose, and potentially, because we bypass the GIT absorption of the drug, we have the ability to potentially reduce some of the GIT associated side effects. So, for example, if someone is experiencing a lot of what we call dyspepsia, or basically heartburn, by using the nasal spray, not only can it be more rapidly effective, but it has had the potential to cause fewer side effects as well. At the moment, this drug is only available in Australia, and it is only available from select sites. The prescription of this medication is currently restricted, and your urologist or your doctor needs to go through a certain process to be able to prescribe this for you. This is very new and has the potential to change how we manage erectile dysfunction. If this video has been of interest to you, if you have any questions or comments, or if you'd like to let me know what you think, please leave your comments in the section down below. Until the next time, take care of your prostate.